The number of seniors suffering from heart failure is skyrocketing, and while there are many factors at play, a large part of it stems from, or is greatly worsened by, nutritional deficiencies. Our soils are stripped of essential nutrients, and our foods are bombarded with pesticides, which further destroy the vital nutrients our bodies need to stay healthy. Even if you try to eat well, sometimes supplementation becomes necessary, especially as we age because our ability to absorb nutrients naturally declines over time. That's why in today's video we're going to break down the 5 most important supplements for seniors that can help lower the risk of heart failure. Now, remember, this is not a substitute for exercise. Physical inactivity still contributes massively to heart disease, and a diet high in carbs can also be a major problem because high blood sugar can damage your organs, including your heart and kidneys. Before we dive in, make sure to hit that like button and subscribe to the channel so more people can benefit from this vital information. Without further ado, let's get started. 1. CoQ10. Coenzyme Q10 or CoQ10 is undoubtedly one of the most important supplements for seniors looking to lower their risk of heart failure. And the science behind it is compelling. Your heart is one of the most active organs in your body, pumping around 3,000 gallons of blood every single day, and each heartbeat requires energy. CoQ10 plays a critical role in producing ATP, which is essentially the energy currency of your cells. Without sufficient CoQ10, your heart cells struggle to function properly, and this becomes especially important as we age. On top of that, CoQ10 is a potent antioxidant that helps neutralize harmful free radicals, protecting your heart tissue from damage that can accelerate the progression of heart failure. Clinical studies strongly support the benefits of CoQ10 for heart health. A meta-analysis published in the Journal of the American College of Cardiology in 2013 found that CoQ10 supplementation improved ejection fraction, a key measure of how effectively the heart pumps blood, in patients with chronic heart failure. Perhaps even more compelling is the Q-Symbio trial, which showed that seniors with heart failure who took 100 milligrams of CoQ10 3 times daily for 2 years experienced significantly lower rates of major adverse cardiovascular events and fewer hospitalizations for heart failure. For best results, CoQ10 should be taken in doses of around 100 to 300 milligrams per day, usually split into 2 or 3 doses. Seniors absorb the ubiquinol form more efficiently than the standard ubiquinone, making it the preferred choice after age 60. Since CoQ10 is fat-soluble, it should always be taken with a meal that contains healthy fats, such as avocado, nuts, or olive oil, to ensure maximum absorption. It's also important to note that CoQ10 can slightly affect blood thinners like warfarin, so anyone on these medications should consult their healthcare provider before starting supplementation. While CoQ10 is naturally found in foods such as fatty fish, organ meats, eggs, and spinach, supplements are often necessary to reach the levels that provide meaningful heart protection. 2. Omega-3 fatty acids. Omega-3 fatty acids are another cornerstone supplement for seniors who want to protect their heart and lower the risk of heart failure. These essential fats, particularly EPA and DHA, play a vital role in keeping your heart and blood vessels healthy. Omega-3s help reduce inflammation throughout the body, which is critical because chronic inflammation can weaken the heart and contribute to heart disease over time. They also improve the flexibility of your arteries, lower triglyceride levels, and help prevent dangerous heart rhythm disturbances, known as arrhythmias, which are a common problem in seniors. The scientific evidence supporting omega-3s for heart health is robust. Large clinical studies, including the GISI heart failure trial, found that patients with heart failure who supplemented with omega-3s experienced significantly lower rates of hospitalization and cardiovascular death. Other studies have consistently shown that regular omega-3 intake can reduce triglycerides, improve arterial function, and even lower blood pressure slightly, all of which are protective for the heart. But advisably, you should get your omega-3s from high-quality sources like wild-caught salmon or sardine if you cannot get high-quality supplement because they easily go rancid if not handled properly. Try to get 2 3-ounce servings of salmon or mackerel per week, and you will hit the recommended goal. 3. Vitamin D3 and K2. Vitamin D3 and K2 are 2 nutrients that work together to protect your heart and blood vessels, making them essential for seniors who want to lower their risk of heart failure. Vitamin D3, often called the sunshine vitamin, is well known for supporting bone health and the immune system, but it also plays a critical role in cardiovascular health. Low levels of vitamin D have been linked to higher blood pressure, increased inflammation, and a greater risk of developing heart failure. Essentially, without enough vitamin D, your heart has to work harder, and your blood vessels lose some of their natural flexibility, which puts extra strain on the cardiovascular system. Vitamin K2 complements vitamin D3 by directing calcium to the bones and teeth and away from the arteries, preventing dangerous arterial calcification. When calcium builds up in the arteries, it stiffens them and forces the heart to pump harder, which over time can lead to heart failure. By working together, D3 and K2 ensure that calcium strengthens your bones rather than harming your blood vessels, creating a protective synergy for your heart. For supplementation, vitamin D3 is typically taken in doses ranging from 1,000 to 2,000 IU per day, although higher doses of up to 10,000 IU per day may be needed if you are deficient, under the guidance of a healthcare provider. The recommended D3 to K2 ratio is 10 mcg of vitamin K2 for every 1,000 IU of vitamin D3. Both vitamins are best absorbed when taken with meals containing healthy fats such as avocado, nuts, or olive oil. 4. Magnesium taurate. In case you're wondering why not just take magnesium glycinate, the reason is that taurine makes magnesium taurate more targeted for heart protection than the glycine found in glycinate. Magnesium taurate combines magnesium with the amino acid taurine, which has its own heart protective properties. Taurine helps regulate blood pressure, supports proper heart muscle function, and stabilizes heart rhythm, making it an ideal companion to magnesium for seniors at risk of heart failure. Magnesium itself is essential for maintaining normal heart rhythm, relaxing blood vessels, reducing inflammation, and supporting energy production in heart cells. When combined with taurine, it provides a more direct protective effect on the cardiovascular system. Research shows that both magnesium and taurine independently help prevent arrhythmias, lower blood pressure, and improve overall heart function. In fact, studies have found that taurine supplementation alone can reduce the severity of heart failure symptoms, while magnesium ensures the heart has enough energy and electrolyte balance to function efficiently. For supplementation, a typical dose of magnesium taurate ranges from 125 to 250 milligrams of elemental magnesium per day, usually taken with meals to improve absorption and reduce the risk of stomach upset. Because both magnesium and taurine are safe and gentle, they are well tolerated by most seniors. Magnesium taurate can also be combined with other heart-supportive nutrients like CoQ10 or omega-3s for a synergistic effect. 5. B-complex. B-complex is important because deficiencies in B vitamins, particularly B6, B12, and folate, B9, can elevate homocysteine levels in the blood, a compound that is strongly linked to an increased risk of heart disease and heart failure. High homocysteine can damage blood vessels, increase inflammation, and make the heart work harder, which is why maintaining adequate B vitamin levels is so critical for seniors. These vitamins also play vital roles in energy production, supporting the metabolism of fats, proteins, and carbohydrates, and ensuring that your heart and other organs have the fuel they need to function efficiently. Studies have shown that supplementing with B6, B12, and folate can lower homocysteine levels, reduce vascular inflammation, and improve overall cardiovascular health. One notable study published in the American Journal of Clinical Nutrition found that older adults who maintained sufficient B vitamin status had significantly lower risks of heart disease and heart failure compared to those with deficiencies. For supplementation, a high-quality B complex provides all the essential B vitamins in bioavailable forms. Seniors often benefit from daily intake of B6, around 1.5 to 2 milligrams, B12, around 500 to 1,000 mcg in methylcobalamin form for better absorption, and folate, 400 to 800 mcg of methylfolate. B vitamins are water-soluble, so they are best taken with food to improve absorption and reduce any potential stomach discomfort. Foods rich in these vitamins, such as leafy greens, eggs, fish, and legumes, are helpful, but supplementation is often necessary for older adults due to declining absorption with age. That wraps up our look at the 5 most important supplements for seniors to help lower the risk of heart failure. Remember, while these nutrients can provide powerful support for your heart, they are not a replacement for a healthy lifestyle. Regular exercise, a balanced diet, and managing blood sugar and blood pressure are equally essential for keeping your heart strong. Before adding any of these supplements to your routine, it's crucial to consult your healthcare provider, especially if you have heart failure or any other chronic health condition. They can help determine the right doses and combinations for your individual needs and ensure there are no interactions with your current medications. If you found this video helpful, don't forget to like, share, and subscribe so more seniors can benefit from this information. Taking steps to protect your heart is one of the most important things you can do for your health, so start today and give your heart the support it deserves.